teacher. My name is Edison Alfredo Tomalaparra. My topic is a follow top tube torsion. Definition. Torsion of the ovary is caused by rotation of the ovary or the annexes that surround the ovary, which can cause obstruction of arterial, venous, and lymphatic flow. It is a rare cause of acute abdomen in women. It is more frequent in the ring tube and usually occurs in the peri-ovulatory phase and is very rare in postmenopausal women. It is more frequent if there is a history of hydrocephalus, tubal ligation, and pelvic adhesions. We continue with a video.
How would you know or suspect a girl would have a twisted ovary?
Oftentimes, a girl will take a torsion of the ovary comes to me evaluated for functional medicine. The symptoms are something like that. Typically, a girl with a torsion of the ovary is a much more acute illness than symptoms. Describes pain as if she was kicked in the stomach. Any side effect sort of slowly progressing to gradually finishing.
There's no rebound, you have appendicitis, push in, it's more painful.
That's typically what they're describing signs of appendicitis.
Application in nursing. Surgery will be applied if a fallopian tube torsion is suspected or confirmed by ultrasound. A laparoscopic or laparotomy should be performed to try to save the ovary and uterine tube by destroying them.
Ovarian torsion is when the ovary is twisted on itself somehow. Usually it starts by there's been a cyst. And if the cyst is there, it makes it a little lopsided, and then something happens where it twists. Here's the important thing. That twist can cut off the blood supply to the ovary, and you can lose your ovary. Yes, you have two, but you don't want to be giving them away. So if you're having severe pain, it's important to know that if it's in the lower abdomen, you might want to get checked for ovarian torsion. It hurts a lot. And it can also feel exactly like an ovarian cyst if you've had those before. The only way to know for sure is to get an ultrasound and check to make sure there's blood flowing to that ovary. And the next thing you have to do, unfortunately, is surgery. Is go inside you and get that thing untwisted. Otherwise, you can lose the ovary, and then you'll never have it again.
Pros and cons. In the pros, you will not find and since it is a disease. Again, this it causes abdominal pain. It causes obstruction in arterial, venous, and lymphatic flow.
Ovarian torsion refers to the rotation of the ovary at its pedicle to such a degree as to occlude the ovarian. Ovarian torsion accounts for about 3% of gynecologic emergencies. The incidence of ovarian torsion among women of all ages is 5.9 per 100,000 women, and the incidence among women of reproductive age 15-45 years is 9.9 per 100,000 women. In 70% of cases, it is diagnosed in women between 20 and 39 years of age. The risk is greater during pregnancy and in menopause. Risk factors include increased length of the ovarian ligaments. Risk factors include increased length of the ovarian ligaments, pathologically enlarged ovaries, more than 6 centimeters, ovarian masses or cysts, and enlarged corpus luteum in pregnancy. Patients with ovarian torsion often present with sudden onset of sharp and usually unilateral lower abdominal pain, in 70% of cases accompanied by nausea and vomiting. The development of an ovarian mass is related to the development of torsion. In the reproductive years, regular growth of large corpus luteal cysts are a risk factor for rotation. The mass-effective ovarian tumors is also a common cause of torsion. Torsion of the ovary usually occurs with torsion of the fallopian tube as well on their shared vascular pedicle around the broadly, although in rare cases the ovary rotates around the mesovarium or the fallopian tube rotates around the mesosalpinx. In 80%, torsion happens unilaterally, with slight predominance on the right.
Issue applied in Ecuador. In a systematic review published in the American Journal of Obstetrics and Gynecology, this pathology represents 2.7% of urgent shoulders, being the fifth most common cause of surgical emergency after ectopic pregnancy curves. Lurions, hemorrhagic EPI in appendices. In conclusion, fallopian tuber torsion is a very rare disease and its symptoms are non-specific. This rare complication should be considered in the differential diagnosis of acute pelvic pain in women, especially if there is a history of tubal sterilization. Thanks for your attention.